I'm Jeff Kittner with the Chamber. We're pleased to have all of you participate in our Civics for Business session today, featuring State Representative John Turner. And first, I want to thank our sponsors of the Civics for Business series, which is Iberia Bank. Shannon Bettis is our board member from Iberia Bank, and then Encore. And Charles Elk is our board member from Encore, and Charles is also the chairman of our board. And both are great sponsors of this series. And thank you to all of you for participating and engaging with us in this unique format during this unusual time. And then I want to turn it over to our friend and frequent collaborator, John Turner, State Representative. But let me give you a little background on John. District 114, which covers a large part of north central Dallas. It includes the neighborhoods of Lake Highlands, Hamilton Park, Preston Hollow, and Midway Hollow, amongst others. He currently serves on the House Appropriations Committee and the House Committee on Environmental Regulation. John was born and raised in the East Texas town of Crockett. During summers growing up, he worked for his grandfather's small home building business and as a news and weather broadcaster for the local radio station. After graduating from Crockett High School, John went on to Harvard College and Yale Law. John is an attorney in Dallas, where he specializes in business litigation, and he's also devoted significant parts of his practice to public interest cases, like supporting our public schools and promoting cleaner air in our cities. John is married and has 2 kids, and we're just so pleased to have John participate in this unique session today. So John, I'm going to turn it over to you, but tell us, can you give us a legislator's perspective on what's been happening on the state level relative to COVID-19?
Well, you bet. And thank you, Jeff. And let me just first say thanks for having me here. And I'm sorry about my technical difficulties a few minutes ago, not being able to be here by video. But I want to also just thank you all at the North Dallas Chamber for all you're doing to keep programming going during this time. I mean, it's been a crazy 6 months. First, we were hit by a tornado, and you specifically, literally, were hit by the tornado at the Chamber, and you kept going in the midst of that, and now you're still going in the midst of this. And I really appreciate all you're doing to keep people connected and to keep our community engaged. And you know, I'll tell you from my perspective what's been happening as a legislator in the middle of all this. Day to day, I typically will be on some conference calls, several a week, sometimes even multiple calls a day, with other legislators or with subgroups of legislators. Sometimes we're talking with the heads of one of our or some of our state agencies. The Department of State Health Services has hosted various calls. Texas Division of Emergency Management has hosted various calls. The governor has actually had a number of calls for the entire Texas Legislature. And usually those are updates. They usually allow for the opportunity to ask questions. And so individual members can try to, I guess, weigh in on what they think should be happening. Often there are constituent-specific concerns that have been raised, and they are discussed on those calls. And then we've had local delegation calls as well. We've talked to Parkland Hospital, for instance, and talked to members of our county government and other local officials. Each member, I think, is of the legislature sort of working in their own way to try to figure out how they can best be useful and contribute to the response. I try to think of questions that I should ask about what we're doing. I'm trying to find out, for instance, just today about the use of the federal funds that are coming to Texas through the recently passed CARES Act. We have been asking questions to make sure we understand the PPE distribution process in Texas and how it's working. And then we're also just available to try to help constituents. And I'm getting a lot more constituent calls than usual, as you might expect, people that are experiencing job loss, small business owners, people just generally concerned about the direction of our response in one way or another and want to provide some input. So it's all keeping me quite busy. Now, what we're not doing in Texas right now, of course, is we're not in session in the legislature, and we are, unusual in that we only meet once every 2 years. There's been no really specific or concrete talk that I'm aware of about a special session at this point in time, although I think it's something we cannot rule out in the coming months. There would be a lot of logistical difficulties associated, figuring out how to safely meet potentially. And I think there would be quite a bit of thought necessary about what would the agenda be for a session if we were to have one. At this point, though, it's just conjectural. I'm not hearing about any concrete discussion of it, and of course the governor would have to call it. So that's an overview, Jeff, of some of the activities that are going on right now from my perspective as a state representative.
Great, that's helpful, John. Thanks very much. One thing that I think we've seen recently is some contradictory positions between federal government, state government, county government, and municipal regarding how best to address COVID-19. Can you talk about what role the state can play to make sure that Texans are staying healthy and protected, and what you as a legislator are doing to try to address some of these contradictory positions?
Well, sure. And first, I'll say with respect to the different roles that we've seen federal, state, and local governments play, I do want to say I think that the steps that we took locally here, that Judge Jenkins and Mayor Johnson implemented the stay-at-home orders and related fairly early orders that were issued were important. I think that potentially, from what I have seen and discussed, put us ahead of where we otherwise would have been. Those orders came about a week or 10 days or so before other similar orders came at the state level. And I think that could have been very important and crucial in us not having a significantly more severe problem than we already have right now. So, clearly there's a role for each level of government here. And I think it was important that we here in Dallas and Dallas County took the initiative to move fairly quickly after we saw how serious the situation was. When we talk about what different governments can do going forward, I'll talk first about just the basic public health situation and maybe briefly the economic situation, which of course is very, very serious right now. But on the public health side, I think it would be ideal to have in the coming days and weeks a good, clear direction on a federal strategy about how we're going to tackle this entire problem. And of course, it could vary by region, and we should allow some regional experimentation and variation. But at least a good consensus on the main elements of the strategy. Where do we need to be in order to begin to reopen, so to speak, parts of the economy? How do we manage to contain the virus if we do ease up on restrictions of various kinds? Do we need a large-scale national testing program in place that would be much more widespread than what we have now, and probably involve some level of surveillance testing as well as just symptomatic testing? Are we going to try to implement contact tracing, such as some other countries have done, to a higher level than we have? Those, I think, are questions that need to be answered. Ideally, at least the broad direction provided at the federal level. I don't think we have those answers yet. At least I think the strategy is probably being discussed right now. Maybe we'll get there soon. But in the meantime, states and local governments, I think, will continue to take initiative as it seems necessary to them. I'll just comment on one thing. There's a lot of questions are being asked about, well, when are we going to decide to open up the economy? And the truth is, the economy is not going to open itself up as long as people are concerned that the virus is not reasonably contained, which is why I think we still find ourselves in this situation where we are right now, with stay-at-home orders in place, severe social distancing regulations in place. And I think we've just got to get to a point at which we have confidence in our ability to gradually start to ease some of these restrictions, either at a local or potentially state level, in coordination with the federal plan. But if we do so and we find ourselves right back in the same situation we had been earlier with a rapidly expanding outbreak, then that we really haven't moved the ball forward very much, because the economy will essentially continue to keep itself largely closed. Now, there may be certain kinds of regulations I think we could look at specifically where the hardship is very severe in some areas, and perhaps the public health benefits, are less clear. We always should be open to looking at individual restrictions and regulations consistent with our overall public health perspective. So there's going to be a role, I think, to take initiative locally and at the state level. If we look briefly at the economic situation, I really think that certainly the federal government is the level of government that has the major ability, the resources that are necessary to tackle bridging the gap between now and whenever we get to hopefully a vaccine that is effective in the population economically. The federal government doesn't have to have its budget balanced every year, unlike state government. And clearly the major aid package that has already been passed by Congress is a first major step there. The unemployment claims are unlike anything we've seen. The impact on businesses is unlike anything we've seen. And the federal government, I think, needs to lead, but the state government and local government will play a critical role in implementing what the federal government puts in place and in supplementing it. One example would be the Texas Workforce Commission right now is the principal agency involved in processing not only the state but federal unemployment assistance that is being provided. The state government, together with local partners, are running our elections that we'll have, our runoff elections, and then our general election in November primarily. So those are just two of many examples where a function that, of course, is federal in nature, at least in part, is going to be implemented at the ground level by state and local government.
John, you mentioned the elections, and I want to touch.
Let's see, Jeff, I might have lost you just for a second. Can you still hear me?
Yes. Can you hear me, John?
Now I can hear you. I lost you for just a second there.
Sure, no worries. And I'll repeat the question. You mentioned elections, and obviously nobody knows how long we're going to be sheltering in place for. Has the legislature given any thought or consideration to how best to address what may happen if we're still sheltering in place in November during the elections, or even going into 2021 into the 87th legislative session? Will y'all meet remotely? What are y'all thinking about there?
Yes, well, great questions. And I'll tell you, so I have just begun to participate in a working group with a few other legislators to talk about the question of just the mechanics of government right at the moment, how the legislature can meet, what can be done under existing law and under the Constitution already in terms of potential virtual meeting, committee hearings, things of that sort. And I don't think we have the answers yet, but we're starting to dig into that in preparation for that possibility. Now, who knows exactly where we'll be come next January, of course. It's a long time from now, but the prudent thing to do is to prepare. We don't know if maybe we might be experiencing a subsequent wave at some point. We don't need to be caught unaware and unprepared. So we're starting to begin to examine the logistical questions related to how you would run a legislative session. In some other states, I think it's a couple now, they've started to move to essentially virtual sessions, virtual voting, I believe. At least I've seen some headlines that suggest that a few states have begun to go that direction. We'll need to answer those kinds of questions, certainly by the time we approach the next legislative session, and even in the interim. Ordinarily, right now, we'd be having committee hearings on interim issues. At this point, it's just it's off. There have not been any committee hearings since the shutdown we're in really got underway. If we were to consider a special session at any point, we'd have to answer some of those questions even sooner. So those are all going to be really interesting and tough questions that I don't think we have figured out just yet, but we're starting to do that. Now, if you I think mentioned the election, Jeff. Well, in my opinion, we need to start preparing now for a potentially different kind of election with wider availability of mail-in ballots. Again, we don't know what November is going to look like in October in this situation, but it's reasonable to think we might need to prepare to allow more people to vote by mail. Right now, there's a question about current Texas law and whether it would permit people who are concerned about their health because of the pandemic to request a mail-in ballot. and whether that could conceivably fit under the different several categories that under Texas law currently allow a person to request a mail-in ballot. We're going to need clarification on that. We're also going to need to prepare for the possibility that we'll just have a whole lot more mail-in ballots than we normally would in a normal election year. And that's something that's going to require a lot of planning on the local level and the state level. And so I don't think, even though there are many urgent issues that people are facing right now, economic issues, health issues, all the rest, we have to attend to those best we can. We can't fail to start planning ahead and make sure that we're prepared come November. We certainly wouldn't want people to feel that it is unsafe to go vote. We wouldn't want to put poll workers at risk. We wouldn't want an election to become a super spreader type event. We just need to be prepared. And obviously, as we get closer, we can further evaluate the situation, but we don't want to get too close and then not be able to do what we need to do.
John, you mentioned mail-in ballots and the circumstances in which they're currently allowed now and where they're disallowed. Can you give the group some more detail on that and what you all might be doing to expand that?
Well, sure. I'll give you my thoughts about it. And this is not something that has really been yet, to my knowledge, the subject of any, overall legislative consideration. Again, we're not in session right now and not doing committee hearings, but I'll give you my perspective on it. Current Texas law provides that you can apply to receive a mail-in ballot, and you have to establish that you fit into one of several categories. Either you are over 65 years of age, you have what is referenced in law as a disability, but it refers to, the further definition of it refers to a physical condition that would put you at risk or make it difficult for you from a health perspective to vote in person. Or there are a few other categories. You're going to be away from the area during the voting period and so forth. So the question arises as to whether that category for disability or a physical condition that prevents you from voting might encompass the situation essentially everybody could be in, where they would feel that they could face a health risk if they were to vote in person. That does need to be clarified. I think it's possible that the Secretary of State of Texas could clarify that issue through guidance that is issued. The governor potentially, I think, could provide clarity on it. But there's also already underway litigation to attempt to clarify the question as well. Texas is really, I think, one of 14, I think is the number of states that does require, in order to receive a mail-in ballot, that you fit one of these categories. Most other states do not require that you have any particular reason for requesting a mail-in ballot. They just, as long as you ask for one, you get it. And in a few, mail-in ballots are just mailed to people automatically, to registered voters automatically, even without requesting. So Texas is kind of different in this regard. The important thing from my perspective is that people will feel safe about the election. We're not going to be in a position of endangering people who are working in the polls and who are often, very often, senior citizens who are in the at-risk categories, and that we plan ahead for potentially a much larger volume of mail balloting than we usually have, because that'll be a difference for our local election authorities and could put a strain on those local resources. So those are the steps I see we need to take. We need to clarify the issue. We need to plan ahead. And my hope would be that we will ensure that people could request a mail-in ballot if they feel it's needed, if we do find ourselves still in a pandemic type situation come election time.
Thanks, John. Let's shift away from COVID-19 for a minute. And obviously we're between sessions right now. We came off the heels of what I think was a pretty successful 86 session. HB3 with school finance reform passed, and that took the efforts of many people on this call and others to help get that through. Can you give us your impressions of the 86 session, what's happening in the interim right now, and a preview for the session in 2021?
Well, absolutely. And I agree with you that we had a number of notable successes in the last session. The largest being the landmark school funding bill, House Bill 3, the most significant increase in support for our public schools we've seen in a long time, and a whole lot of innovative ideas and projects that I think are really worth exploring, and also a reduction in property tax rates at the same time. So a lot of positives that came out of the last session, especially on the education front. And, you know, I had been thinking before COVID-19 came up that the theme of this next session might be, let's build on the progress we made in the last one. Let's sustain that commitment to schools. And as you say, you're absolutely right, Jeff, that this was a major effort supported by the business community and the public education community and parents. I think bipartisan, a really strong result, and we needed to make sure that we were prepared to sustain that commitment. I think we would likely be thinking about focusing on some areas of our public education system and pipeline that didn't get as much attention last time, like the transition to higher education, to community college, to improving outcomes in four-year colleges and universities, and be looking at higher ed. And of course, we didn't do as much on the health front last session as we did on the education front. And so I think there was a general feeling that healthcare was likely to be a focus in the next session. Well, you know, now we do, not to go back again to COVID-19, but it is where we are. It's really, I think, changed what we're now facing in the next session. And instead of just looking only at building on the progress we made last time, we're also now looking at a lot of damage repair potentially, and determining what kind of budget situation we're going to be facing as a state. And I think it's premature to talk too much about it, since we don't know exactly how it's going to look when we go back into our next budget year. But we can already, I think, foresee the possibility that it could be a very significant situation. The revenue picture for the state is going to look very different. We made some major commitments to public education from a revenue standpoint in the last session, and we're going to have to see how that now looks. I think it's very important that we resolve to support our public schools and to keep moving forward, even in the midst of this pandemic, to support our kids, because it's a critical priority and a primary mission of the state to do so. But we're going to have to evaluate what does the budget situation look like, and what are our healthcare needs, and see where we stand. I'll just say a couple of things that I hope will be the case next session. One is, I really hope that we don't continue our attacks on local government next session. We're seeing every single day how important local government is in the middle of this pandemic. I just think it's time to turn down the volume on that adversarial relationship that's existed too often between state and local government. I also hope that redistricting can be done in a more bipartisan, less divisive way than has happened in the past. We've got so many other important things we're dealing with in state government right now, and the pandemic just made the issues all the more urgent. It's just not the time to allow a session to be dominated by a partisan fight over redistricting. And I hope, even though that will be on the agenda for us to accomplish this next session, I hope we can do so in a more efficient, less divisive way.
Thanks, John. One other issue that you mentioned.
Hey, Jeff, you're breaking up on us.
Oh, I lost you again, Jeff.
Yeah.
For Medicaid.
Hey, Jeff, you broke up on us. You're going to have to repeat that question.
Okay, sorry about that. John, you touched briefly on healthcare as well, and that, I think, is something that'll be a priority for the next session as well. And for those of you who haven't done so already, I'd encourage you to read State Senator Nathan Johnson's op-ed in the Morning News from several days ago on Medicaid expansion. And John, I don't know if you could briefly touch on your position on Medicaid expansion and what efforts you've made and you think the legislature will make in that area in 2021.
Yes, you bet. Another important issue, and I read Senator Johnson's piece the other day in the Morning News, and would again encourage everybody to read it in support of Medicaid expansion. I feel the same way. I think, yeah, I supported this in the last session. In the past, you know, the business community, many elements of the business community have been supportive of it as well. Texas Association of Business several years ago came out in favor of accepting those additional funds under the Affordable Care Act that Texas could have to expand coverage. And you know, I think as the op-ed by Senator Johnson the other day pointed out, the COVID situation tends to further support the wisdom of that choice. I think if we had expanded Medicaid previously in Texas, there's a good chance that the problems we're facing now, while still certainly be very, very significant, would be somewhat less severe because you'd have a higher percentage of people covered. We have a large uninsured population in Dallas, and we have to reckon with that as we try to confront the pandemic. And you know, we'd probably be seeing better support across the state for hospitals right now. Paradoxically and sadly, a lot of rural hospitals are struggling right at this very moment, even almost looking month to month to try to stay open because they don't have current patients at the moment, and their revenue streams are off because of the various reasons, but including cancellation of other procedures in order to reserve space for potential COVID-19 patients. So it's a rough time for hospitals. It has been for rural hospitals for a long time. Medicaid expansion would have helped with those things, and I think it still would in the future. And so I think it'll be on the agenda, no doubt about it. And we'll see what the political dynamics of that are. But I think the general direction has been gradually a movement in the direction of considering it, and I hope that will continue in the next session.
Great. Thank you, John. And I think that will be one of the Chamber's public policy initiatives for 2021 as well. So if we can be a partner for you in that, let us know. Last question before I turn it over to our group with some questions. One thing personally for me is in 114, as you know, many people are still being impacted by the tornado from October. And FEMA has recently denied the city's request for FEMA funds. Can you talk about how is happening from the state perspective with tornado recovery?
Well, yes, absolutely. And you know, my district, District 114 here in North Central Dallas, probably had about 65 to 70% of the damage from the tornado, and maybe even a little more of the major damage from the October 20th tornado. It's still a huge concern, and we're still not where we want to be yet in terms of rebuilding. And many folks whose homes were destroyed in the tornado, they're now sheltering in place or staying at home in temporary housing or temporary apartments. So this is still a really big issue, even as we deal with the coronavirus. Yes, I was disappointed that we didn't have, that FEMA's initial decision was to deny federal relief to our localities, to our city, county, school district. I am, however, hopeful that they will reconsider that. There is a process to appeal FEMA's ruling, and my understanding is that FEMA's judgment was that we had not yet, as a region, demonstrated that we had the necessary threshold of local costs directly related to the tornado, uninsured costs, to warrant the declaration that would free up the federal funds. But we will have additional information to submit at this point in time about the school district costs, the destruction of the campuses at Walnut Hill and Cary and Thomas Jefferson High School that ought to put us over that threshold. So I'm going to be working on that. My office will be involved in giving our input to the appeal that the state will submit and that the city will be joining in. And I'm hopeful that we'll still see some relief funds there. It won't necessarily change the situation on the ground that we're dealing with. We still need to move forward with recovery as soon as possible. work out any insurance issues that might be delaying recovery and rebuilding. And my office has also been engaged in that as well. And, hopefully we finally move forward and we get back to a normal state where we recognize our neighborhoods to be much like they were before this disaster last October.
Thanks, John. I know many of us are looking forward to having some recovery on the tornado front as well. Let's open it up to some questions from the group here. Cece Gassner, our board member from Texas A&M Commerce. Cece, I see you've got a question. Do you want to unmute and ask it to John and a comment?
Yeah, sure. So I just want to say I wholeheartedly support mail-in ballots, and thank you for your support of that as well. One concern I have is just whether we need to consider any policy or process improvements so we don't repeat what happened in Wisconsin last week. I have some close family there, and they said that there were apparently hundreds of ballots that were mailed in and received in time, but for some reason didn't have the appropriate postmark. So I don't know if there's some coordination we might want to also be doing with the U.S. Postal Service just to make sure that there's just seem to be, unfortunately, far too many glitches that are occurring with mail-in ballots, which is really tragic.
Well, that's a great point, and I've taken a note about that to inquire about that. I mean, broadly speaking, in order to conduct an election with a much higher number of mail-in ballots, a lot of preparation is going to be necessary precisely to avoid those kinds of glitches and to make sure that we're just equipped to handle it. So it's not the type of thing where we can flip a switch, a few weeks before the election and just make that happen. The planning needs to start now, which is why I think the clarity needs to be provided now or very soon related to whether people who are concerned about health effects of in-person voting can request a mail-in ballot. And so that, not to mention, I think, frankly, we need to be prepared because we still are going to have in-person voting likely available to people. So we need to be prepared to handle it in a way that's going to be safe and sanitary. That's not something I think we've dealt with before in any significant way. And so that's one of, probably 1,000 things that will need to be thought about. Now, we do have some federal money that has come available for this kind of planning and for the additional resources for this preparation. There may be more coming down the way, but it's a great point. We need to be prepared to imagine those sorts of glitches and head them off, hopefully.
Thanks, John. We've got a question from Corolla Broadus. Corolla is one of our lead ambassadors. Corolla, do you want to unmute and ask your question?
Yes. So thank you. So my question is, a virus such as the coronavirus or another virus coming down the pipeline, such as the coronavirus, can go unchecked. So in other words, a pandemic like this could happen again if things do not go unchecked. So what have we learned? And I also understand that at the local and the state and federal level, each has its place and what they can do. But what can we do or what have you all learned at the state level that we can put in place to reduce economic impact and death toll impact to Texans? And can the business community help in that effort?
Well, it's an excellent question. Thank you. And well, I think in part we're learning as we go. But one thing I would say is that I think there is no doubt when we go back into session next, we're going to already be talking about the next possible pandemic and what have we learned and how can we be better prepared. We never should find ourselves in a situation where we are concerned that we don't have enough protective equipment, that it's possible that our hospital system could be overwhelmed, that we don't have sufficient staffing, that we don't have enough nurses, that we don't have facilities available in rural areas. All of those things are going to have to be really looked at in a serious way at the state level the next time the legislature meets. So that's something we've certainly learned. I think, the question of the right way to contain and respond to a pandemic in the future, clearly a lot of, very skilled and smart people studying that right now, and I'm not sure if we have yet a consensus developing on it. But I will say that, when you look at the quick action that we've seen taken in South Korea that involved a much higher level of testing, quickly available, a much higher level of tracing of contacts than we saw in the initial stages here in the U.S. To me, just as a layman, those seem like elements of future preparation that we cannot neglect. And I think a lot of that is going to probably be, and should be initiated at the federal level, because it's going to be a national issue and a national concern. And businesses will need to be involved in that. And we're going to have a process where we really sit down and say, what have we learned about what happened in the initial stages of this pandemic, and we'll continue to learn throughout this whole process. You mentioned the economic impacts. I think there's a fair debate that can be had about where are resources most helpful. Is it most helpful to try to ensure a very robust system of unemployment insurance, or do we somewhat put more weight on the assistance to businesses to keep employees on the payroll? Right now, we're doing both. We have payroll protection programs available to business, especially small business. We have loans going to industry, and we also have a large amount of money going to additional unemployment benefits, and we have direct benefits going to people based on income levels. We're doing it all right now. I think we'll have the chance to look back and see, okay, what worked best? What did other countries do that was different? And were there any success stories that we should learn from and be prepared in case this happens again?
Thanks, Corolla, for that question, and thanks, John, for the response. Deb Stogie, Deb is with AECOM, and she's on our board, and she's also our public policy chair. Deb, do you want to unmute and ask your question? Okay, well, I'll ask Deb. Oh, there you are, Deb. Go ahead.
Thank you, Representative Turner. And you were just with us about a month ago, and I just want to tell you, I guess, what a difference a month makes. And so we appreciate everything that you're doing. Karen Mendelson, our councilwoman from my district, just posted on this chat that the governor had just announced a small business initiative right as we were starting this call. And I was wondering if you had any information about that to share with the group. Is it related to implementation of CARES or something completely different?
Well, to tell you the truth, I haven't had a chance to look at it yet, so I do not know. I am not aware of what the announcement has been. I don't know if this is a follow-up to what the governor said last week, that he'd be announcing some initiatives soon relating to trying to safely reopen certain sectors of the economy. I have not seen it yet, so I guess I better not comment on it.
All right.
You're right. You're right about the difference a month makes, by the way. I was thinking about that the other day. We had still met in person, although everybody was starting to exercise some social distancing about a month ago, but we're in a different world now, and it's really amazing to reflect how much has changed.
Well, if you'd allow me to just add on a question, because, I think we are all thinking about, obviously, taking care of the current situation, which is the response, but also thinking about the economic stimulus packages that are coming through. What kinds of conversations have you all been having at the state level about, programs for economic stimulus? We hear potential infrastructure and other things, and just wondering if you could share any thoughts with respect to those discussions that are being had at this time.
Sure. At this point in time, I guess there's discussion about several issues. From a state budget standpoint, first of all, we want to make sure that we don't have cash flow difficulties or problems, and the comptroller on the calls I've been on has assured people he does not see a cash flow issue for the state at the moment. When we meet again as a legislature, we're going to have to make decisions about the rainy day fund and what we should do there. I mean, we still have a pretty healthy balance. I think it's something like 12% or so of our general revenue budget is available in the rainy day fund, and this is certainly the kind of situation that fund was envisioned to address. The ability of the state to provide major economic stimulus, I think, is limited just by virtue of the fact that we have to balance our budget, unlike the federal government. I think, to me, the right way to think about stimulus is to think about partnering with the federal government. Also, potentially to think about ways we can, especially here in North Texas, we have a tremendous healthcare, medical, science resources to try to make sure that we're fully utilizing all of the talents and all the skills that could help us get through this current pandemic from a health standpoint, and also prepare for the next one. Now, that's not necessarily broad scale stimulus to the entire economy, but it could provide a boost economically while also helping us address preparation for these kinds of public health events. I think the key, though, is to be able to look at the stimulus we've been providing so far at the federal level to try to begin to assess how it's working, how it's helping, and then learn from that, and then be prepared to take the next steps, most likely at the federal level, and let the state be as good a partner as we can be.
Great. Thanks,
Thanks,
you so
John.
much.
Thanks, Deb. We've got time for, I think, one more quick question. Jean's iPhone has a question. Jean, do you want to go ahead and unmute and ask your question?
Yes, I'm unmuted. The news the other day that North Texas Food Bank was running out of money to purchase food is disconcerting, seeing how long the lines are. Is there any plan at the state level to step in and help North Texas Food Bank? And I think Houston is in the same boat.
Great question. I don't know the answer yet, but I do know that it's something we need to start looking at. I have actually just made some inquiries this morning about the issue of food supply. We have, when I woke up to watch the news this morning, I saw the news about crops that are going unused all across the country because of the decreased demand in the restaurant industry. And of course, the logical question is, well, we have a high degree of food insecurity now. We have food banks that need more food and need more support. Can we try to find a way to put those two together and make some connections? That's something I want to look into. I certainly think as large an agricultural state as Texas is, it's something we need a plan to address. Again, the prudent thing to do right now is to be prepared. We don't know the trajectory of the virus or the economy with any precision, but we need to be prepared, and food insecurity is going to be an issue. And our food banks are under strain like they've never seen. They're receiving more requests than they have probably ever. I don't know the complete facts, but certainly vastly out of proportion to what they would have expected right now. And so we need to make sure we do support them. And if the state can find a way to help make that happen, we should. And that's something I'll be looking into, and I think it's a great question.
Thanks, John. Any final thoughts you want to leave us with before we close out?
I think all I would say is, to a certain degree, and I know that it's natural to want answers. We need to understand where are we heading. We want to know, are we going to have school in the fall? Are colleges and universities going to reopen? When is the economy going to reopen? How long is this going to last? I understand all of those questions, and I think we need to do our best to start answering some of them. But we have to also be willing to live with a certain degree of uncertainty and take things day by day and continue to recalibrate all of our responses based on what we learn. I try myself not to approach this situation with any sort of preconceived ideology, other than we need to be prepared to experiment. We need to be prepared to take action. We need to be prepared to help. And then we need to try to ask ourselves what is working and what is not. What are the unintended consequences of what we do, and how can we address that? With that mindset, together with the resilience that we've shown as a nation state and community over and over, we'll get through this. It's not an easy time, but we will get through it.
Wonderful. Well, thank you so much, John. We've really enjoyed this session. Thank you for your continued partnership with the Chamber and your representation of District 114. As a thank you for participating today, we'll be making a contribution in your name to the North Texas Food Bank. So thanks for the question about that.